Hello friends, this channel is about nursing education. Nursing foundation is the base to render nursing care to the needy, sick or healthy individual. So this subject will help the healthcare providers to acquire desirable knowledge, attitude and skill to forms the basics of the nursing practice. I will be covering multiple choice questions in nursing foundation which will help all the nursing students for the wide variety of entrance exam. So let us start. Examples of medical diagnosis are hypertension. Hazards of restraint is nerve damage, pressure sore, foot drop and all above. So the answer is all above. Callus is formed by friction. Indication of chest drainage is pneumothorax. Pneumo means air and thorax means thoracic cavity. So the right answer is pneumothorax. Contraindication for nasogastric feeding is gastric surgery, paralytic ileus and gastric bleeding. So the right answer is all above. For blood transfusion, the size of the IV cannula to be used is answer is 18 gauge. Urine for Hay test is to detect the bile salts. The answer is bile salts. And for detection of the bile pigments, we do Gamblin test and we do Fawcett test. So for detection of the bile salts, the test is Hay's test, and for determination of bile pigments, the test is called Fawcett test or the Gamblin test. Stat means at once. The stat means at once. The process of sanitizing and preserving human body is called as embalming. When we treat a dead body with the chemicals to preserve it for a long period of time, the process is called as embalming. The purpose of record keeping is follow-up, education, research. So the answer is all above. An organized conversation with a patient to obtain health history is called as interview. The right answer is interview. The residual urine that remains in the bladder. The residual urine that remains in the bladder means the urine that is remaining after the voiding. After once the patient has already passed urine, after voiding the urine, how much ever is urine left in the bladder is called as the residual urine. Discharge summary of the patient is to be written always by a doctor. Patients' perception about their health problems are grouped as the subjective data. The person who described the nursing as a process is Lydia Hall. The person is Lydia Hall. Lydia Hall was care and cure and core nursing theory giver. She gave the theories for care, cure and core nursing theory. An example of inhalation anesthesia drug is halothane. The answer is halothane. Halothane was used for the induction and maintenance of general anesthesia few times back. Euthanasia. Euthanasia means mercy killing. The answer is mercy killing. It is an act of painlessly putting to death a person who is already suffering from a very incurable and very painful disease. So the answer is mercy killing. The nerve that may get injured during fault while giving injections are sciatic nerve. Drugs or fluids into the bone marrow is called as intraosseous. Whenever we are giving an injection in the bone, it is called as intraosseous injection. Administering therapeutic agents including food outside the alimentary canal is called as the parenteral therapy. It is called as the parenteral therapy. In medication error, the first response by the nurse is, what should be the first response? It should be check the patient's condition, number 1. Then notify the physician, number 2. Then act upon and then record the error in the medical case sheet. That will be done by the doctor, and completing an incident report is done last. An abnormal unexpected response to a drug is called as idiosyncratic effect. Idiosyncratic effect is an adverse reaction with an unknown mechanism, maybe fever, maybe skin rash, maybe neutropenia. What is an anaphylactic reaction? It is a severe drug allergy which can be potentially leading to death. Complementary and alternative therapies are used by minority of patients. So what are the complementary and alternative medicine therapies? These are massage and acupuncture and green tea. They are used by very minority of patients. A combination of traditional medical care and complementary alternative therapy is called as integrative care. It is called as integrative care. What is holism? Holism is a traditional and cultural practices. Allopathy is when we are treating the patient with the medicines. And what are the Chinese medicine therapy? When it is based on the Chinese tradition, that is the Chinese medicine therapy. The smallest infectious agent capable of causing an infection is virus. So that's all for now. I have covered almost 25 questions. Hope you like. Please like, subscribe and share, and you can comment your queries in the query box. Thank you so much.